Hello Dedalus friends and family, we're back here at HIMSS TV in HIMSS Riyadh, Saudi Arabia with our good friend James Norman. Today we're going to talk about efficiency. James, a lot of people at the event over the last few days have been talking about creating efficiency in the healthcare ecosystem, trying to find better efficiency, trying to squeeze efficiency. What's your thoughts? What's your opinion on that?
Well, it's a really good point. See, what we've focused on here is clinical efficiency. And for me, efficiency starts for the whole ecosystem. It's supply chain, it's about efficiencies in the running of the hospital. It's obviously clinical efficiency, it's efficiency in energy utilization, it's efficiency in terms of treatment out of the hospital, out in the community. So it's bringing that whole system together. If you just focus on one area, you miss out opportunities across the way. So when we talk about efficiency, from Pure Storage side, we're talking about one aspect,
right.
But actually that aspect is an underpin for everything else. Energy efficiency, how is that going to improve the running of the hospital? It's going to reduce the energy draw. How is it going to improve the electronic medical record? Well, it's going to improve the performance and capability and availability. How are you going to then enable patients to get better access to care? Well, actually, by freeing up cost and enabling greater performance with your EMR, what you're able to do then is move your teams to actually focus and concentrate on other areas of work. So that's when I talk about efficiency. I'm more interested in that whole picture.
Right, so it seems like a circle. If you start somewhere,
That's
sort of
right.
you get around to efficiency. And if you were going to start in one particular place, because that's the other question that most people will look at. Well, where would I want to start? To begin with, even if it's just a little piece, where would that be?
Yeah, so I'd always start with going back to basics.
Okay.
So if you try to improve clinical efficiency, you have to take it pathway by pathway by pathway.
Yes.
It takes a long time, and in fact, by the time you've probably finished, you'll find some of the medical procedures or thinking will have changed, and you'll be constantly refined. So just start with the basics. Start with the underpinning platform, the medical record you're using, the viewer, the dashboard, the tools that clinicians have got. Look at how you're going to present them, how you're going to run them. How are you going to ensure that you're hitting your scope targets? Simple things like that. Energy efficiency, utilization, performance, things that clinicians will say, okay, I turn my computer on, instantly I've got access to the data.
Right.
If they're having to turn the computer on and walk away and make a cup of tea, or they're finding that they're having to make 20 clicks to get to the data, they won't use the system, or they'll find a workaround. Right. So always start on the basics. Get your infrastructure right, get the running of the teams and the capability, make sure that your systems, operating systems, your applications are optimized, then look at how you can redesign the patient pathway.
Brilliant. Thank you. That's a great answer, James. Thank you. And I think many people are going to have to revisit their current efficiency structures now and see if they can modernize them, right?
Yeah, well, there's a big focus on around what we call the ESG, your
Yes.
environmental sustainability gains. And part of that is looking at how you can move care out of the hospital. Part of it is how can you reduce your draw on the national grid in terms of electricity usage, sustainability, your carbon footprint. But for me, all of them complement each other. And this is why I said, you have to look at that whole ecosystem. If you're going to make an improvement, make the improvements along the whole journey.
Right.
And don't just start with the clinician. Start with the back office, start with the environment, or bring the whole lot together. That's how to do it.
Great, thank you for that. Really appreciate it. So James, around the halls today, we've seen quite a few speakers that went up on stage and talked about AI, innovation, improvements in AI, the modernization of AI. What's your view on AI and where do you think it's going?
That's a really good question, Sam. So everyone has their own opinion on AI, and It's interesting to listen to a number of the speakers talking about the different use cases, not going too far too fast.
Yeah.
There was a great talk earlier on which was looking at bias and how you're bringing it in. A real big problem for Saudi because of the population size and the fact that all the AI algorithms have been trained in European populations. Of course, that gives you a 5 to 10% variation and reduces the effectiveness of AI. But the real challenge that we've also heard is around the capabilities of the technology to actually run the AI in the first place. We've seen massive advances in GPU performance to deliver this. And what that's actually enabling is the algorithms to be trained concurrently on data sets. So we're now seeing near real-time capabilities coming out through AI, which we weren't before. Before it was more in the research field.
Right.
So as we look forward, as we see technology progress and improve, we're going to see real-time clinical decision support coming through with the use of AI to help not second guess, but give a second opinion to clinicians.
Absolutely.
Now, it's not going to replace clinicians, not for the foreseeable future. Maybe 5 years and we'll start to see small diagnosis coming through the AI route. But at the moment, this is helping clinicians to think, right, have I made the right decision here? Because it's a lonely job. So having that support, I think, is going to be where it really focuses.
Great. Yeah, no, I see that. I definitely have heard that over the last few days. But the other thing that brings me on to is that we're talking about all this technology, we're talking about all this data and all this AI, and how are we going to circumvent security around that? How are we going to ensure that data is protected?
Yeah, and actually that's a really good point, because as you start to open up healthcare, moving it out of the hospital, what that means is you're creating more and more touch points. So more and more of the bad actors who are trying to get in and access data are opening up. So you've got to be very cognizant of this. And I was an ex-CIO myself. This is one of the things that used to keep me awake at night. And now that I work and engage with healthcare organizations, this is always one of the top topics on their agenda. From my perspective, it's trying to keep it simple. There's so many different applications, processes for managing and locking down the data. You can go to the extreme where you actually prevent clinicians from being able to do their job. So you have to find the right balance.
Yeah.
Work with a tool set that actually is simple, goes end to end. Look at infrastructure that has security built in by design, that isn't an add-on and constant licensing, or where you're having to make sure you've got the firmware updated. And I know that sounds technical, but honestly, it's the simple things that catch people out. Have you done a new patch? Well, we couldn't, because the application wouldn't run with it.
Right.
So we left it. There's your vulnerability. So try and find basic technologies that don't require that kind of capability, that are managed and update for you. That always helps. Make sure that your staff understand their role and responsibility. Everybody in healthcare has a duty of care to make sure that they're concentrating on protecting the patient data and the application, who can access and govern it. So, if you get all those right, get yourself a security strategy. I know it sounds a bit fancy, but actually it's about keeping it simple. The training, the infrastructure, the software tools, how are they all linked together, and who owns and the governance around it. Make sure you've got all those in place and you're on a firm footing.
Brilliant. Some wise words from James Norman. Thanks, everybody. See you soon. Bye-bye.
Just look at the camera.
Yeah, all right. Love it.
All right.
All right, I'm rolling.